Hello and welcome to the program. I'm your host, Neil Howard. Glad that you could return for another segment of Health Professional Radio. We'll be speaking with nationally known ophthalmologist Dr. Neda Shamie. She's joining us here as partner of the Maloney Shamie Vision Institute in Los Angeles. She's going to discuss the signs, symptoms, and treatment options for cataracts, as well as findings from Alcon's Global Alcon Eye on Cataract Survey. Welcome to Health Professional Radio. Dr. Shamie, thank you for joining us.
Thank you so much, Neil, for inviting me to join you.
I did, of course, mention that you are an ophthalmologist. Give us a brief look into why you chose this area of expertise.
Well, thank you. I chose this area of expertise because really, truly, in medicine, as far as surgical subspecialties are concerned, ophthalmology is one that allows us to really impact our patients' lives in a very, very direct way and quite rapidly. I mean, there's not a day that or a week that goes by without me having patients really, truly feel like their life has changed because they go from vision that has really impacted their day-to-day life, their ability to tend to their needs, to having 20/20 vision the next day. And so it's a happy field. It's also very elegant. Advanced technology is applied to what I do on a daily basis. And it's a very rapidly evolving field, which keeps me young and excited and on my toes every day. So I love what I do, and I sure hope to share that enthusiasm with you when you hear about all the wonderful things that ophthalmic surgery can offer patients.
Well, what are cataracts and who is most likely to be affected?
Yeah, cataracts is a very common problem. So if you are lucky enough to live a long life, you will develop cataracts. And what cataracts are basically clouding of the natural lens of the eye. It's the aging of the natural lens of the eye, very common. And so everyone will have a mother, or grandmother, or an uncle, or an aunt who has had cataract surgery. And the way it impacts the vision is essentially the clouding of the lens can cause difficulty with seeing. And the initial symptoms are typically driving at night. Patients describe glare and halos around oncoming traffic lights or difficulty seeing the street signs. Patients also describe difficulty reading. People start having feeling like everything is dimmed. Colors are not as bright and crisp. And it happens gradually, so it's not necessarily overnight. Who's at risk, as I mentioned, as you get older, so definitely the elderly is more commonly developing cataracts. But if you've had exposure to autoimmune conditions or to anti-inflammatory medications like steroids, it could also lead to cataracts at a younger age. There are congenital problems and such, but most commonly age-related. Diabetes can put you at risk for earlier onset too.
You said that it was an elegant type of field, very specialized surgery. What does that surgery involve, and is this something that you have to, endure a hospital stay for several days? Is this outpatient surgery? Is it done in an office? Take us through a typical surgery briefly.
Absolutely. Great question. And it also fits another point that I brought up, which was a very rapidly evolving field. Because, 20 years ago, cataract surgery was very different than it is now. Now it's an outpatient procedure. I actually did 20 of such surgeries today and just finished about half an hour ago. So you can imagine it's a short surgery. Patients come in about an hour before the surgery time just to get prepped for the surgery. They're awake throughout the surgery. They receive some IV medications for relaxation, but eye drops, numbing eye drops are really the only thing necessary for numbing of the surgery site. The surgery can be done both manually as well as with laser. My approach is typically laser cataract surgery, and that is a laser is used within 2 minutes. The laser energy opens the capsule that the natural lens lives in and softens the cataract. It also can create incisions to treat the astigmatism. And then I go in with microscopic instrumentation under a microscope while the patient is awake, but, kind of half asleep. with the help of medications through the IV, and I remove the natural lens that has become cataractous or cloudy. And then I replace that natural lens with a lens implant. And that's the key advance in our field, in the field of cataract surgery, is the technology used in those lens implants that we implant. The lens implant is what then gives the patient not just clarity of vision, but also gives them an opportunity to see at long distance as well as mid-range and near without glasses if an advanced technology lens such as the Clareon PanOptix or the Clareon Vivity is used. These are two lenses. One is called a multifocal lens. It's in the category of a multifocal lens. Another called an extended range lens. And this is where the nuance of cataract surgery is, really having those conversations with patients, really gauging what their desires are. And a lot of patients don't realize that with cataract surgery, it's the cataract surgery of today is not the cataract surgery of their parents, because, 10, 15, 20 years ago, there was only one type of lens available, and it was just single focus. Now we have extended range lens, we have multifocal lens, as I mentioned, and these lenses can give our patients independence from glasses, which is really life-changing. So you now go from having cloudy vision, difficulty seeing the street signs and such, to not just having 20/20 vision at distance if you have a PanOptix or a Vivity lens, but also be able to see the computer without glasses, be able to read without glasses. A very, very youthful way of life at an older age. So really exciting.
Once you've had cataract surgery, is there the possibility of a second surgery simply because of time? If you get surgery at 60, by 80, would you be needing more surgery, or is that something that's a one shot and that's it?
Yeah, it's a one shot and that's it, really. There's cataracts does not come back.
Okay.
And the fact, patients often say to me, but my prescription has changed every year. How can you say that it won't keep changing? The point is, most of the time the prescription is changing because cataract is evolving and developing. And so when you remove the cataract, the rest of the eye is typically, in most cases, is typically very stable. And so the prescription doesn't change. So if you have cataracts, if you develop cataract and have cataract surgery in your 60s, you can enjoy fantastic vision until many, many, many years, decades and decades, unless you develop other pathology in the eye. But that's another issue altogether.
Tell us some of the findings from Alcon Eye on cataract survey. Were there any, eye-opening information?
Yeah, absolutely. Well, Alcon is a global leader in eye care and has really kind of has been a trailblazer as far as really developing the most advanced technology in what we do in cataract surgery and such. And they did the survey and really opened our eyes, no pun intended there, to the lack of awareness among general population. So this was a survey where the survey participants were pre- and post-cataract surgery patients aged 50 and older who had received their diagnosis in the last 5 years, and also people who were age 50 and older who have been diagnosed with cataract, who had not been diagnosed with cataract. So this is the demographics of patients that you would think should be aware of what cataract surgery entails and what options that they have. And unfortunately, and thankfully, the survey really pointed this out and brought awareness to us. Only about 58% of the global population, this is a global survey, age 50 and older, recognized that cataract surgery involved implanting a permanent lens in the eye. And only about 50% understood that they can choose from several different types of lens options to fit their unique needs. This is concerning to me because, honestly, there's a gap there. And the gap is that we have these incredible advanced technology lenses that deliver on the promise of being able to give patients 20/20 vision at distance as well as mid-range and reading without glasses. And yet most of our patients don't even know that they have these options. So unless they go to a surgeon who is offering them these options, they're not empowered with the knowledge to be asking for them. So what you're doing right now is really fantastic because you're bringing awareness to it. And what Alcon is doing is really try to bring awareness to the general population as well as our professional colleagues about this gap in knowledge. What was positive and exciting was that when they surveyed those who did have cataract surgery, great majority of them felt that the cataract surgery gave them more youthful vision that was more like when they were much younger, which is not surprising to me, truthfully, because these are daily stories that I hear in my clinic. Patients come in tears saying, "My gosh, the last time I could see this well, I can't even remember when it was." Colors are beautiful. I never remember. I didn't realize my walls were white when they've been looking yellow for the last 10 years. So it was a great survey. And then lastly, I'm going to also comment on this. This was interesting. So of the 50-year-old and older, 84% of the global population in that age group wear glasses and rely on glasses. And then 70% of them surveyed felt that they would absolutely feel liberated without their glasses. And again, another reason why, as eye care specialists, we need to empower our patients with the knowledge that there are options. And these advanced technology lenses are really a wonderful game changer, wonderful kind of life-enhancing opportunity for our patients, where they could feel more youthful when maybe other medical remedies don't necessarily turn back the clock. But as far as cataract surgery is concerned, use of advanced technology lenses most definitely makes patients feel like the clock has been turned back. And another reason why I love what I do every day.
Well, give us a website where we can learn more, if you would.
Yeah, absolutely. MyCataracts.com is a wonderful resource that can, answer a lot of questions that patients have. Also, just ask your doctor. So hopefully everyone has an eye doctor they can rely on, but most definitely empower yourself with the knowledge and ask the questions from your eye doctor. After all, the eye doctor is one that can really direct and guide every patient.
Dr. Shami, thank you so much for joining us here on Health Professional Radio.
Thank you so much. I really appreciate you giving me a platform to talk about what I love to talk about.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Neda Shami. Audio copies of this program are available at healthprofessionalradio.com.au, also at Anchor, Spotify, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.